WDKY in Lexington. The Fox 56 Morning Edition starts now.
Time is now 7:42, and osteoarthritis in the knee affects more than 10 million people, and treatment options are a bit limited.
And many patients are looking for a safe alternative to surgery, and here to tell us about the bionic knee is Dr. Joe Dobner from Rebound Orthopedics and Sports Medicine, and his patient, Ina Sturm, who's using a product. We want to welcome both of you. Thank you for coming.
Good morning.
Doctor, why do we hear so much, it seems, these days about knee pain and discomfort?
There are a lot of people with, like you mentioned, it's 10 million people. And everybody is more active, and the population is aging. Our lifespan is much greater, so now we're living long enough to suffer the consequences of our genetics and our youthful indiscretions is what it boils down to.
Well, you brought this along with you to kind of show us what's what here. Tell us what we're seeing here.
Well, this is an unloading knee brace. When you wear out your knee, it's often on one side or the other primarily, and you can wear one of these braces that push in a certain way that takes some of the stress off of one side of the knee. And it's one of the modalities of non-operative treatment of knee arthritis. Losing weight, exercise, taking medications, and some minor surgical procedures. Sometimes cleaning up the knee helps, and then you can use the unloader brace or the BioniCare treatment, which we show here is a pulsed electrical stimulation that helps with the homeostasis of the knee.
Mm-hmm. And I know you were telling us this has made a big difference to you, no doubt about it.
A huge difference in my life.
What was your issue? When did you start having problems?
About 2 years ago.
Mm-hmm.
And I think it was an injury that then precipitated into torn cartilage, and Dr. Dobner kind of cleaned it up, but it just didn't seem to work, so he suggested this. And I have upstairs and downstairs, bedrooms are all up and laundry rooms downstairs, so I'm up and down the steps all the time, and I really wasn't able to do that. So after he suggested this, I can bounce up and down pretty well.
Oh, that's good to hear. Yeah. Who is this best for? Anyone who's having some knee problems?
Oh, it's primarily for someone who's got osteoarthritis, and what that is that the running surface, that smooth white stuff, has been rubbed, and so now it's just really rough and grindy. And what we did is we smoothed some of hers out, but you can't make it normal like you started with. And once it's gotten to the point where there's excessive friction, then you've got to do something else, like the medicines or this. And about half of the people, this is fairly dramatic.
All right.
Excellent.
Well, sounds like certainly an option for some. Thank you for coming. We appreciate it. And Dr. Dobner, of course, your office in Frankfurt, right?
Yes, sir.
Yeah.
I'm glad you're doing so well. Thanks for sharing with us.
Very good. Well, the top 10 took on the legendary Billy Joel on American Idol last night.
We'll